to introduce someone who is a friend of mine, a dear friend, sort of like a sister. I always forget that she is also incredibly brilliant in so many accolades with letters behind her name. But a funny story is when my older son was delivered in the hospital on September 19th, 2012, my mom crossed paths with another new grandma in the hospital. And then a short 6 weeks later, I joined a new moms group, bouncing an infant on my lap, disheveled, being like, what happens? I don't know what to do with an infant child. And I met Jenny. Jenny had her son on the same day in the same hospital, 2 hours apart, delivered by the same doctor. And we've been best buds ever since. When Sean got his diagnosis, was the first person in my life to read the article and sit down with me and say, hey, let's talk about this. Did you read this? What about this? In a way that was so loving and so compassionate and so understanding, but also has really helped me push through and advocate for him. She is the first person I go to when I have any questions about what's happening with his IEP, with school, with neuropsych testing. She has helped me navigate so many hurdles to get Sean the best possible support that he has in the school system. I need to stop because I'll just keep talking, but I am absolutely delighted to introduce Dr. Klein Sosa to talk about neurodevelopment and neuropsych testing. So, welcome.
Thank you, Kara. Didn't know I was going to cry on the way up here, so thank you for that. Alrighty, so thank you all for being here. I know it was a late night, and you all had a great time last night, I hear, so that's wonderful. And I know it's another early morning after a really intense weekend, so I appreciate you being here to listen to this. And I was going to tell you a little bit about my relationship with Kara, but she's already kind of covered that for me. We have really, our families have become very close with one another over the years, and I have to tell you that we have been in awe of the ways in which the Kilroy family has navigated really tough times, really joyful times, in watching Sean grow over these years. And whew, all right, I'm going to put that aside for a moment, just to say that I am so grateful that Kara asked me to be here today to talk to you about this really important topic. This gives me a chance to contribute in a really small way to the really remarkable efforts of the JDVS Foundation in bringing families like yours together to learn, to share, to connect, to support one another. These are important times. And I just want to really call out this foundation for how unbelievably amazing you are in bringing this together. So thank you so much for all of what you do. So as Kara said, I am coming to you from many different perspectives. One, having been involved with a family who has a child with JDVS, but I'm also a mom myself. I have 2 kids. My older son is about to turn 13. He is an ADHDer. I don't know if anyone has heard of this term before, but that basically means that he's on the spectrum and he also has ADHD. And my other kiddo, who's younger, navigates the world with anxiety. So they've got their own challenges that we work with in our family. Professionally, I've worn several different hats, all dedicated to supporting kids and families. I'm a clinical child psychologist. I trained in Florida, I've worked in DC and in Massachusetts in a variety of different clinical practices. Most recently, my most recent position as a clinical psychologist was at a private practice doing neuropsych evaluations. And in that role, I had the privilege of helping families like yours understand how their child's brain processes information experiences the world, and learns. And in that process, I helped families understand data and use that data to build a roadmap for their children. I also spent a few years as an educational policy analyst, also focused on using data, but in this instance to inform systematic change that impacted the special education landscape in Massachusetts. For a while, when my son was first diagnosed with autism, I took some time away to really focus on his needs, and so I know what that feels like too. And when I returned to the professional world, I really brought together all of my experiences as a clinical child psychologist, as a mom, as an analyst, to choose a new path, and this is in that field of special education advocacy. I serve on state and district advisory boards, and I'm a special ed decision maker for kids who are in DCF custody. So I see this from many different aspects. So when I talk about understanding your child's unique needs, when I talk about advocating for your child's best interests, when I talk about finding the paths to their success, I just want you to know that this comes from a place of professional understanding, but also personal perspective as well. And I want you to also understand that I'm not a researcher. The researchers spoke yesterday, and nor am I an expert on JDVS. I've known one child with JDVS. But I do want to offer, and hoping to offer, some useful insights and some guidance about the neuropsychological evaluation experience, what the process looks like, and how to get the most out of it. All right. So, I recognize that in this room there's probably a variety of experience. So I'm hoping to get a sense for who you are and what your experiences have been. So if you have ever experienced a neuropsychological evaluation yourself, had one for your child, or know something about that process, please raise your hand. Okay. If you are pretty much completely new to it, this is something you've never had for your child, you don't really know a whole lot, please raise your hand. Okay, so we have a variety of folks in the room today. And I expected that, so what I'm going to try to do is be pretty general and focus on the really practical aspects of the process and give some advice on how to approach things in a way that you can get the most out of it. Actually, as a starting point for everybody, I do want to emphasize that a neuropsychological evaluation, which I'll call a neuropsych or an eval as we go, is about, broadly speaking, gaining a deeper understanding of how your child's brain works and how that impacts their everyday life. A neuropsych evaluation provides a comprehensive perspective that integrates data about your child's abilities across many different areas, including how they think, how they feel, how they behave, how they learn, and how they navigate their physical, medical, educational, and social life experiences. In addition to giving you that better overall understanding of how all the pieces fit together, it should give you concrete guidance about the types of supports and services and accommodations and therapies that can help your child reach their maximum potential and build a life that's fulfilling and joyful. So let's dig into that a little bit here. So first, an evaluation can help you understand how the JDVS characteristics relate to the specific challenges that you might see at school, at home, or with peers. It connects the dots between characteristics that you heard about yesterday that are commonly seen in kiddos with JDVS and the real-world impact that looks like in their day-to-day functioning. This kind of evaluation is essential for establishing a baseline for tracking progress over time. That baseline is going to be really invaluable for your kids as they receive interventions, as their development progresses, and as the learning demands increase every year as they go through school. That will help you adapt the supports that they need as you go along. The next point is really crucial. A neuropsych eval can help you understand how your child learns best. Every kid has a unique learning style, whether it's visual learning, hands-on learning, whether they thrive with repetition, or maybe they need extra time to absorb information, or to show what they know. Knowing more about the learning style of your child is going to help you figure out and help your team figure out which teaching strategies are going to be most effective for him or her. Also, a neuropsych is going to help you to understand the behavior difficulties that you might see in certain circumstances. We know that challenging behaviors aren't just misbehavior, they're a form of communication. They can also be an expression of underlying cognitive or emotional struggles. So an evaluation like this can uncover issues like executive functioning challenges, emotion regulation difficulties, or processing challenges that contribute to behavioral concerns, and that will pave the way to figure out which are the targeted interventions you need in place to support your child. Further, an eval can help your child understand their own thinking and their own behavior differences when they're at a point in their development that you can explain that to them. This can be really empowering for your child. It can reduce anxiety, it can foster self-awareness, and help them be good self-advocates as they age. Results of a neuropsych eval can also help identify neurological or psychiatric challenges, differences, and diagnoses that require specialized interventions. Also, and this is a really important one, you want to match expectations for your child with what their strengths and weaknesses are, what their profile looks like. You want to make sure that goals in an IEP, for example, are realistic, that they're challenging, but not too overwhelming. So you need the information to be able to do so. And finally, very importantly, the findings from a neuropsych eval empower us to work collaboratively as a team to develop the best treatment plans and school plans for your child. So these are a number of different ways that a neuropsych can help any child, really. But what about kids with JDVS specifically? Yesterday, we listened to key researchers in the JDVS field talk about the characteristics that we often observe in these kiddos. And we have some information as well about the concurrent diagnoses. So this information can be really powerful in framing the questions that you bring to a neuropsychologist to look at in an evaluation. So let's take a moment to review. So based on the existing set of research that we have so far, the most consistently reported core defining features of JDVS are the neurodevelopmental challenges that stem from the PPM1D gene mutation. We understand that delays in meeting developmental milestones, particularly in infancy and early childhood, are the highly consistent feature of JDVS. Significant challenges in developing speech and language skills are common, and delayed speaking is often one of the first concerns that are noted. And delays in development of motor skills like sitting and standing and walking are also observed. We also understand that intellectual disability is a highly consistent feature of JDVS, and we also know that the severity can range from mild to severe. We see significant challenges with learning and development of cognitive skills, but there can be a great deal of variability between verbal and nonverbal skills observed in each individual child. So, in addition to these neurodevelopmental challenges, I've also included the range of other JDVS-related characteristics here that have been documented in the areas of physical and growth markers, medical and regulatory vulnerabilities, and dimensions of behavior and personality. As you review these, it's important to say here that even with neurodevelopmental defining features, genetic syndromes often show variability in how they manifest child to child. Not every single individual with a PPM1D mutation will display every single symptom that is listed here. And the ways in which some of these characteristics are exhibited in one person can vary quite dramatically from another person. So I include this full list here to note that a neuropsychological evaluation can and should cover all the relevant domains that are listed here, but also will likely focus most deeply on the areas of neurodevelopmental challenges, behavior, and personality. So in addition to talking about the defining characteristics, it's also important to talk about the diagnoses that individuals with JDVS appear to be at higher risk of developing. Now, I know the idea of more or different diagnoses might feel overwhelming. It might feel very difficult. But to that, I want to offer some perspective. It can be helpful to think about a diagnosis less as a label and more as an avenue for finding the right supports. Sometimes a diagnosis can be a helpful shorthand for providers and others in the community to give context to a collection of symptoms, and clarity can lead to identifying the most effective treatments and interventions for your child. So as we look at the psychological and psychiatric diagnoses in particular that are shown here, I want to say I'm going to touch on these in more depth later, but it's important to know that these can be explored thoroughly through a neuropsych eval, but not as much through other kinds of evaluations. So, one of the questions that I have often gotten from families is, well, we are already receiving supports and evaluations and testing through the school, so why go through the process of a neuropsych evaluation? Well, I'm going to give you a few reasons why the evaluations differ. School testing usually is focused. It's focused on answering specific questions, and it can be pretty limited in which areas they assess. So for example, if there's a question about, say, reading development, a school typically will assess in a cognitive area, in literacy skills, and maybe do a little bit of motor skills, fine motor testing. But they often don't look at other academic areas. They may not look at anxiety and the impact of internal state on external outputs. They might not look at processing efficiency. There are a number of different factors that the schools often leave out of their evaluations. In addition, school evaluations tend to not look at factors that affect outside of school circumstances. So for example, self-care skills in the home, or safety skills and navigating in the community. Schools usually will not do full evaluations assessments of those areas, but a neuropsych will. The schools really, the primary intent of their evaluations is to determine eligibility. Should they receive services in school, and what should those look like? Also, educational testing usually happens on a typically every 3-year schedule. And that might not align with what your needs are, or what your child's changing conditions are. So, you can use different evaluations sort of in concert with one another, but a neuropsych is really going to give you that big, holistic, comprehensive view. Also, a neuropsychologist has the background, the training, the understanding to be able to diagnose. Typically, schools will not do that. So if you're exploring some of the other diagnoses that we saw on the previous slide, that's where you're going to have to go. You're going to have to go to a neuropsych to be able to see if those diagnoses apply to your child. Let's see. Next, you might have questions that extend beyond what the school system will typically address. So for example, schools operate on the perspective of meeting a child's needs with the resources that they have available. But what if you're looking for information that's beyond that? What if you're considering other schools that are outside the public school system? What if you are considering specialized schools that provide different kinds of services than what's available in your public schools? A neuropsychologist can work through that with you and understand the range of educational placements and programs and services that are out there. And finally, a neuropsych can help us forecast and prepare for potential challenges that are upcoming. Big transitions, going from elementary to middle to high, also the big T, they call it, transition out of the K-12 system into a more independent life. All of that can be folded into the questions that you bring to a neuropsychologist. So, who is the neuropsychologist? Who are the folks who you should be seeking out to conduct one of these evaluations? Now, generally speaking, neuropsychologists and clinical psychologists are the folks who are best positioned to conduct a neuropsych evaluation. They have a minimum doctoral degree. Sometimes the neuropsychologist will have specialized training through fellowships or practical experience in brain behavior relationships. But really, these are the three that you should really seek first. Other medical and service providers can give you very important perspectives and offer deeper evaluations in specific areas of functioning. They also provide treatments and interventions, like therapies and medications, whereas a neuropsychologist typically focuses very squarely on the assessment side of things and will refer you for the therapies. In terms of identifying someone, finding a neuropsychologist or a practice that can evaluate your child, there are lots of different avenues that you can pursue to find someone. I would say that, first and foremost, I would look to your local hospital system. If you have a children's hospital that's nearby, if you have a trusted friend who has been, taken their child to a certain clinic and had really good results, those are probably the places to go first. Word of mouth is gold in these situations. You want to make sure that you find someone who gives the kind of recommendations that are actionable, not vague, very specific to your area, to the needs of your child, and the best way to find out if those reports that you get at the end are useful in that way is to talk with other families who have been through it. You might not find someone who's familiar with JDVS. It's probably unlikely there's someone local to you who has knowledge of JDVS. But you might find someone who has experience working with children who have other rare genetic conditions. And that can be important for a couple of reasons. One, that person's going to be used to doing the kind of background knowledge, seeking, to be able to put findings into context for your child. There are other kinds of clinicians who specialize in associated areas that could also be helpful. If they, maybe not rare genetic conditions, but say you find a neuropsychologist who is really specialized in bringing together evaluations for individuals who have autism. Autism can present in so many different ways, or intellectual disabilities can also present in many different ways. So folks who specialize in a particular area that is applicable to your child might be someone that you could pursue. Also consider if these folks do classroom observations or go to IEP meetings. Not all neuropsychologists will do that, but these are really valuable roles that they can play in the longer-term advocacy for your child. The last point here talks about insurance coverage. This is a really important. So neuropsych evals tend to be pretty costly. They usually are anywhere from $2,000 to $8,000. The range can vary dramatically depending on your area. So I think that it's incredibly important for you to reach out to your insurance companies and find out who's covered, who's in network, and also who's out of network. At the same time, you're getting referrals from your friends or from other, related service providers. What you want to look for here is convergence. You want to look for an individual who has the kind of background in, related disabilities or rare conditions, also, has a track record of providing really useful reports, and also is covered by your insurance. That's sort of the holy grail, someone who has all of those boxes checked. But if you can't find someone who has all of that, you want sustainability. You want to make sure that, your insurance can cover a very costly expense here, longer term as well. And sometimes it's useful to go back to the same person for different evaluations as your child ages, because they will see that progression for your child over time. So, consider all the factors when you're deciding on someone. And, for different folks, each of those factors might weigh, differently. So with all of that in mind, I want to talk a little bit about the steps. Let's say you have that list in hand of a couple of folks that meet all the criteria you're looking for and are covered, but you don't know how to choose between them. The first thing that happens is you make an initial call to the office. And in that call, you're going to speak with someone who's going to ask you some basic questions about your child, about their development, about what you're looking to gain from the evaluation. It is equally as important in that call for you to ask questions of the clinic about all of the different providers that they have and who has availability and what their backgrounds are. It's about fit. You want to make sure that you're finding the right person for your child so that this experience is something that is motivating rather than difficult. Once you finish that initial call and you find someone who you believe is going to be the good fit, who you believe is going to be covered, it's sort of like, approaching any medical evaluation, you're going to receive lots of paperwork. You're going to have to fill out all of the privacies and the release of information and history forms. And that's going to give the neuropsychologist sort of a basic understanding. And we're going to talk a little bit more about what else to share with the neuropsychologist before you step in a moment. But from the paperwork, you go to a series of different kinds of evaluation pieces. And there really are 4 components to a neuropsych evaluation. The first is that structured interview. So after the initial call and the paperwork is done and you send in some forms, they'll sit down with you and they will go through what they call a structured or a semi-structured interview, which essentially will assess in depth the areas that you're asking about. If you suspect your child may have ADHD, may have autism, they will go through a line of questioning that will take you down each of the criteria to be able to help determine whether or not they're meeting criteria for particular disorders. So that's the first piece, is the structured interview part. The second piece are rating forms. So rating forms usually are in these social, emotional, and behavioral realms. And those rating forms are going to be for you as parents to complete. They're going to ask you to send them to the teachers at school, maybe to other providers or child care professionals that work with your child. Rating forms are really, really important. And to get as many collateral reports as possible is going to be really key in understanding how your child how their behavior might look in different settings. The third part before I get to that, the third part is the testing. And we're going to get into that in a whole lot of detail. But the testing is usually one-to-one. It is with the psychologist and your child, with no one else in the room. And in a typical approach, a neuropsychologist will schedule one big long day, many, many hours with a few breaks. And we can talk about what you can ask in terms of modifications to that schedule that are going to better fit your child's needs. But that's the testing piece. And then also there's this idea of observations. Now, a neuropsychologist is going to make a lot of observations when they're working with your child, certainly. But also it is important to take a look at how your child functions in the school classroom. Actually, it could be multiple contexts, but particularly in the classroom. If a neuropsychologist is able to come into the classroom, they can look for signs of anxiety, they can look for overwhelm, they can look for how they're interacting with their peers, they can look at which are their preferred activities, which are the harder activities for them, they can look for distractibility, what environmental factors are in that classroom that could be adapted to better serve their needs. They also can look at how the teacher is interacting with that child and what kinds of strategies they're using and which ones are effective and which are potentially less effective. They can look at lunch, recess, unstructured time. They can look at structured lessons in the classroom. They can look at transitions. There's so much rich information in the classroom setting that I would encourage folks to consider when you're looking for someone and when you're developing a plan for a neuropsych to include that classroom observation piece. It's really, really pivotal. Next, before you come in for the interview, I have some ideas here for how you can prepare. So sometimes it's difficult to think back, depending on where you're at when you receive a diagnosis, where you're at when you come in for your first neuropsych. Take some time to sit down as a family and think about where were those developmental milestones reached, at what ages, what were the challenges around that, what did that look like for your child. Gather as much information as you can from the schools, from treatment providers, medical teams, and also we now have access to a number of research studies that can be really informative for what to look for and what to tune into in one of these evaluations. So share those with your neuropsychologist. And also speak to others through the foundation, and we'll talk a little bit about setting expectations with your child when we get to the testing portion. So, testing considerations. I'm going to go over several here with some ideas and thoughts for how you can approach testing for your child in a way that's going to benefit him or her most. First, the first section here says alternative and additional tests. The point here is to be proactive in shaping what the evaluation is going to look like to your kid's needs. So The types of tests that will be chosen are going to be guided by the questions that you're asking. So don't hesitate to be very specific about the concerns that you have. Some of the questions can be things like, is our current school the best fit? Is this the most ideal learning environment for my child? Does my child have other diagnoses that haven't been identified yet? Should we be considering different or additional kinds of therapies or treatments for my child? You can ask for a test list in advance, and that can allow you to even suggest some additional areas if you feel like they're not being covered. Also know that if your child isn't using language much yet, you can ask about alternative assessments. There are assessments out there that are for nonverbal or pre-verbal individuals, and it's fair for you to bring that to their attention. In the next part around timing, spacing, and breaks, this is what I was referring to before when I said the typical span is 1 day long testing. You don't have to do that. You can ask for a different testing schedule. What I would recommend is to make sure, number one, that whenever testing begins, that there isn't, confirm with the school that there isn't concurrent testing happening, so that your child isn't fatigued, your child isn't having to go to many different tests all at once. You can break into many sessions. You can ask, in my opinion, I think it's probably better to ask to have a lot of shorter individual testings where there isn't, one big long break and then the second testing session. Break it up into several days. It's really important for your child to feel successful, feel good about what they're doing, and a lot of times through these testing experiences, they're gonna feel like they're failing. So the more you can spread it out and the more that you can make it positive for them, the better. Try to have them there early morning sessions instead of after a long day of school. And when you have breaks during a testing session, make sure you include movement. Get out of the testing room, walk around the block, whatever you need to do to keep your child motivated. Next, we move on to the attention piece. So here's some strategies to help maintain focus and attention. Talk with the evaluator about switching between tasks that you know your child is going to prefer or want to do and the ones that they're going to find more difficult. If verbal tasks are going to be tough or letter identification kind of tasks are going to be tough, then make sure that the days in which those are presented, you have other tasks that are more hands-on, maybe with blocks, maybe with puzzles. Your evaluator will know which ones those are, but be upfront about what works for your child and the things that they like to do so that the testing schedule can be adjusted accordingly. Fidgets are an interesting one. Sometimes they can be super helpful in keeping attention and making a child feel engaged, and sometimes they can be distracting. So, have these conversations with your neuropsychologist in advance to let them know what works and bring those with you if it's allowable. The next part I want to talk about is the parent in the room section. Before I get to the point of this, I want to talk a little bit about what we call standardization. And you're probably all familiar with this notion, but essentially in a norm test administration, that basically means that the test is given in the exact same way every single time to every single person. This allows the evaluator to have confidence in comparing the results from your child to the results from groups of other individuals who also took that same test under the same conditions. In most cases, an evaluator is not going to change any of the usual standard protocols. And in most cases, having another person in the room is not going to be allowed. So that's just to preface. Now, that said, you might want to see if being in the testing room as the parent might be possible, because you might think that might be helpful to your child. So you can have those conversations. Your presence could reduce anxiety. It could help them show what they know. It is true. If you're not actively interacting with your child in the room during testing and the protocol is otherwise unaltered, then it could be allowable. The evaluator would simply note that your presence was there in the final report. You may also want to assist your child in ways that facilitate their participation, pointing to things, helping them out. You know what works best, but in my experience, given that there are really strict protocols, it's probably going to be less likely that that would be allowed, and if you did do that, you should know that it might put at risk the validity of the results of the tests. So it's kind of a trade-off here. So I wanted to give another option, and this is a common practice that is done in neuropsych evaluations. It's called testing of limits. And essentially what it is that the evaluator will go through the tests as usual, following the standard protocols, and not deviate from that. But once that's done, and that's the piece that will be used for scoring and results later on, once that's done, there might be an opportunity for you to enter the room and assist, and the evaluator can give additional questions or additional tasks to be done with your extra support to see how they do and see how far they can go. So that can be really valuable information that is gleaned from that as well, to see what worked in that environment, to push beyond what they would have shown on their own. So just keep that in mind, and it's certainly a discussion to be had before the testing starts with your evaluator. Next are incentives. Immediate rewards, of course, bring small things, little rewards that he or she can be given throughout the testing, but also talk with your child in advance about, something they can earn longer term, because this is likely to take multiple sessions to complete. And another one that I really want to focus on is the idea of rescheduling. If things are not working, oftentimes parents have a hard time saying, I don't think we should be doing this anymore. I think we need to stop. You should feel comfortable saying that to your evaluator. You should feel empowered to say that. You know when your child has hit their real limit, and pushing them beyond that can be counterproductive. So just know that that is something that you can do. And then there's a variety of other factors to consider in terms of, letting the evaluator know in advance about sensory sensitivities, making sure that your child continues to take their medications on a regular schedule. Sometimes parents are tempted to say, well, I might not give, ADHD meds this morning just to see how things go. I would caution not to do that. Follow typical protocols in terms of administering medications on time for your child. Make sure they sleep well and that they have good snacks on the day of testing as well. So, what is the testing? What are the areas that we look at? I'm coming up on time here, and what I'm going to do is I'm going to review these areas just in broad strokes, and I just want you to know that I have a number of slides that I'm going to send home with you, or we can email out to you all, that really look at which domains should be looked at for which diagnoses. So let me just start broad scope here. These are the areas that any neuropsychological evaluator is able to assess. They want to look at the intelligence or the cognitive abilities. This is how your child thinks and learns. Adaptive functioning, this is how your child manages daily life. Transitions are part of this, especially for older students as they move toward independence. Academic and pre-academic skills. Here, this can be a part of some evaluations and not others. Oftentimes, neuropsychologists will not include this because they will think, or they will say that the coverage is really in the school system for the academic piece, but you can still request that they include a piece of this to be academic. Mood and behavior will be looked at. This is anxiety, depression, other psychiatric symptoms. Executive functioning, there are a number of tasks and abilities that are under this umbrella. This is really sort of the management system of the brain. This is how do they approach new tasks? How do they organize themselves? How do they manage their time? This is a really, really important area. Also, memory is something that a neuropsych will look at, how they learn, store, and retrieve information, speech and language and information processing, social understanding, and pragmatic skills. So this is how they interact with others, how they navigate their social world. Sensory processing, visual motor integration. And underneath these, you can see there's a number of different sort of sub-areas within each domain. A typical neuropsych eval will cover all of the checked areas. This is why it's really important to bring information about JDBS and about what your goals are for this evaluation to the evaluator, so that they can expand beyond what this basic set of tests will include. So I'm going to stop there and just say that for some of these other areas, I can continue on or I can stop, or we're going to do some questions, but I have the checked boxes for any neuropsych, and then the circles are for specific particular domains that should be assessed for certain diagnoses. And so for here, this is for intellectual disability, autism, ADHD, and anxiety disorders. And I'm happy to talk in the next session about this, but I just wanted you to have both an understanding of which are the areas that need to be delved into to explore the different diagnoses, and also I give you some examples of each of the most highly used or most commonly used assessment tools in each of those domains. And at the end, you're going to have a feedback session. They will review with you all of the results of testing, and ideally they will give you a very concrete set of recommendations. Usually this happens a few weeks after the last session of testing, and then the report will follow weeks to months later. I encourage you to set expectations with your neuropsych evaluator so that you understand how long it's going to take for you to receive that final report. The final report is really important in terms of lining up other kinds of evaluations and getting the information to the schools and using what recommendations they're given. So you want to make sure that you schedule with enough time, if this is going to be used, say, for an IEP, that you're going to have that report in hand before that happens. So I'm going to stop there. And just know that you will receive all of this information through email later, and I'm happy to talk afterward as well. Thank you.
I think we're going to take some time for a few questions for Jenny because she has a wealth of knowledge. So she will be sitting at one of the round tables, navigating the educational arena in a little bit. But does anyone have any general questions, anything that came up on the slides that they would like to ask Jenny while she is up here? Yes, Natalie.
Intervals would you revisit that doctor and ask for the test to be redone?
Typically, the recommendation is anywhere between 18 months between evaluations and 2 years.
Okay.
But it really depends. There can be circumstances that come up for your child that might make you want to have that sooner. So, if, let's say, they had a new diagnosis come in, like a PANDAS diagnosis, for example, then you might want to take that moment to use that new information, bring it to a neuropsychologist, and see where they stand at that moment.
Okay.
So,
one more question.
yeah, of course.
What's the youngest age that a child can be diagnosed with an anxiety disorder?
So pretty young. The first one that comes to mind is separation anxiety. We usually see that in really young kids. Some of the other ones, the developmental course can be different. So I think it's specific to the type of anxiety that you're seeing. I think it can vary widely child to child as well, but anxiety is one of the ones that you can see fairly young.
So how do you ask for the follow-up? So you have the first one, because I've been told he just needs that one.
How do you ask for the follow-up? Can you tell me more?
The psychologist, so the psychologist did it, and he has a psychiatrist, and they're like, oh, he doesn't need, he's already had it, even though it's 2.5 years ago now. How do you say?
So in other words, you're being told by other providers that
You've
have
already
the
had
information.
this. Yes.
Well, it's really, you are able to pursue it independently of what anyone else might recommend. If you feel like you're noticing differences, let's say a child moves from elementary to middle school, and the last time they had a neuropsych was several years ago, and now they're in an environment at school where the challenges are completely different. They're having to change classrooms. The academic demands are higher. There's a lot more taxing on their executive functioning and a need to process information a lot more quickly to keep up. A neuropsychological profile can look very different in that environment. So I would say trust your judgment. If you feel like there's been a transition, there's a reason that you're feeling that your child could benefit from different kinds of resources and you don't really know what those are yet, I would say pursue it. Talk with a neuropsychologist and see. They'll also give you a sense for whether or not a full evaluation is needed at that time, or maybe they could do a follow-up to the previous one that they did that's a little shorter.
Hi. Thank you for lovely presentation. So I was wondering, more additional comment maybe. So you have to inform the doctor. So yesterday I had a one-on-one talks with several parents. Yes, the doctor don't know about Janssen-de Vries syndrome, but they should be willing to learn. And what I think is, so the foundation already, so this more comment, has already information on their website, on JDVS. And I would like to refer to the Human Disease Gene website, where we actually have very good information, both for professionals as well as for parents. And you can actually print this and take this to your professional, whoever it may be, and say, read it. The thing is that the natural history will also be shown on that website at the same time. So you provide your data, and we will transfer this to the website, and we'll keep this up to date. So that might even be more helpful, because all those lovely papers Cynthia is writing on Janssen-de Vries syndrome, and I'm doing a couple of things, they're not so handy for professionals, but the websites are. So please use those.
Thank you.
We had an evaluation done when my son was like 4.5, and a third of the results came back and said, like, based on his age and ADHD, like, these may vary and don't rely on them. And then most recently, his school triennial also said they couldn't complete a lot of the testing based on his ADHD, and we're now fighting with the school to get them to pay for an outside evaluation. So that at what point, with a kid with strong ADHD, is it a reality, he's 8 or 9 now, that like they can't get results, or do you push back and say, no, we need a provider that can work better with kids with ADHD to get the results? Is it real that like they just can't for some of them?
So what I would say is that, yes, the challenges are real, but I would always say continue to push. So in the school context, it is not enough for them to say, we just can't. It is their responsibility. So, there's a certain, level of testing that they are required to do on a regular basis for your child. And, however, maybe they need a new person who's interacting with the child. Maybe they need someone with more expertise. Maybe they need to break it up and, into more sessions. There are ways to approach testing that can better meet a child's needs when it comes to attention. And the same goes for a private evaluation. I would say continue to push. There are also different kinds of tests that can be used that are more sort of screeners. So maybe they wouldn't give you as in-depth information, but they can still give you a sense for a domain. And I think, schools probably are going to be less likely to have those kinds of tests than a neuropsych, in the private practice. So they may not, have access, but you should be able to find a provider who does and who is willing to adapt, in a number of different ways to serve your child's needs. Saying that they just can't attend, I don't think I would not take that as a parent. I would continue.
I have a follow-up question. I did fight with my school board to get her neuropsych testing, which the school then paid for, but I felt like I was very specific that they had to be broken over 2 or 3 days, and she wound up taking her into a room and coming out many hours later where they blocked me. I wasn't allowed to go in at all. And when I asked about conclusions of tests, she said, oh, we got through like 3 minutes, and then, you know, we moved on because she couldn't finish, and those were the conclusions of the test I got, and I'm just curious to what extent I can not be the mom that's fighting all the time and say, I really need another neuropsych test that, you know, somebody takes time and breaks them over days versus just pushing for the one day, you know, conclusion.
So advocacy fatigue is real. This is something that a lot of families struggle with, constantly having to push the school to do things right and to match your child's needs. So I just want to call that out as a real thing. That is difficult, and I commend you for even having gone through the process of getting an IEE and an independent evaluation that's paid for by the school system. That is a hard thing to do. And then to, you know, be confronted with an evaluation that isn't exactly what you wanted in terms of how they did it, that's very tough. You know, it's always going to be a balance with schools. They have finite resources. And, you know, even in terms of the external providers that they would contract, there's only a certain, you know, stipend that they will pay for that, and therefore they get a certain kind of service from that stipend. So it is limited, and sometimes, you know, it's a matter of being very vocal in the IEP meetings about what you view as limitations to the testing that was done. School systems will tend to refer to their own testing much more heavily in terms of decision making versus an outside neuropsych. Just know that. There's, you know, outside neuropsychs can provide such rich information, but they're not required by law, they as in the schools, to accept and incorporate everything that comes externally to them. They're required to consider it, and that is different. So, you know, I wish I could say it gets better. It might or might not. It depends on your team. You know, I've had families in 1 year who have gone through these processes and then several years later have a just completely different team at a different school, and they're much more understanding. I would say keep pushing, keep advocating, be vocal in your meetings about, you know, what happened in the testing and how you feel that the results may or may not be representative of your child. And use that information, if you do get a neuropsych, to say, here's another alternative of information that we should be looking at, because this actually was administered in the way that fit my child's needs. And you can compare and contrast that way.
I just wanted to say, given the importance of the neuropsych, well, I'll go back. We had Bradley's neuropsychs, all of them, before we had the JDVS diagnosis. So I strongly recommend that you really vet the psychologists who you pick to make sure that they have experience with complicated children. Because I had 7 psychologists do the testing before I found somebody who really got Bradley and gave him a diagnosis of global neurocognitive disorder. It was sort of like this big umbrella that had ADHD, anxiety disorder, other diagnoses underneath. And that, given the time that it takes your child to be tested, okay, given the expense, it's really worth your time to try to make sure that you have the right person, because I've wasted a lot of time and money.
I fully support everything that you just said. I think that you are so on target. You need to have the right person who is taking the right look. And also, I mentioned briefly, asking whether or not they'll come to IEP meetings with you is really important, or do those classroom observations, be present in your life after the evaluation is over. That's also really, really important. They don't all do that. Thank you.
I just wanted to share just an experience I had. I've talked to Elizabeth and Jenny and their wealth of information, and they were really helpful. But we had different results. I know you said that they came back and said, you know, that they couldn't test and get a good result due to the ADHD. We had a provider who gave a result that was very inaccurate, and we ended up taking him somewhere else with almost 30-point difference. so I actually wish they would have done that, so that, you know, I wasn't getting inaccurate results. I a little bit respect that too, but then obviously finding the right provider, I don't think that, I think it's hard to know, because we thought we found the right provider when we did that, and we asked a lot of these same questions. Also, just because your insurance, it might not be in network. Both of the providers I used, they were out of network, but I was able to get it covered. So I did want to point that out, that there are specific codes, and some of these, when you get the super bills, some of the ones that are out of network don't take the time to actually do the correct codes, and you'll submit it and it'll get denied. But there are specific codes that, as long as your child shows a need of meeting it, if it is out of network, you can still get a super bill and get it covered through various codes. So if anybody has issues with that or whatever, I'm happy to help with that process, because it took me about a year to get it all covered. But I got all of it covered out of network.
And that's a great point to follow up on that too. Check both with your behavioral health and your medical coverage, because depending on the JDVS diagnosis, some insurance companies might cover this under medical, and you might be looking in the wrong place.
That was actually my question, and so it was a great segue into it, was like payment, because I'm just like seeing dollar signs when you're talking about like, and then they'll join the IEP meetings, and I'm like, yeah. I'm just kind of like, the logistics of that are going, so in order, I just am like confused about how, because we have a 2-year-old, so we're not even in the school system yet, you know what I mean? So do you have, in order to get it potentially covered by insurance, who makes that referral to a neuropsych? Your pediatrician, a developmental pediatrician, does it have to have a referral, just from the insurance perspective?
I think it depends on what kind of coverage that you have. If it's a PPO or an HMO, you may or may not need a referral. It's going to depend on your particular circumstance. Typically, PPOs don't require a referral, and HMOs will. So there's that. But also, you know, who gives the referral? It can be a medical provider, but I believe it can also come through early intervention. So I don't know if you're connected to any EI services in your area, but if what they typically do is sort of, you know, initial screeners in the basic areas, motor development and speech and language, and if they can show some evidence that there are some emerging deficits there, then they can make that referral as well. So, you know, explore with your pediatrician, explore with EI. I think those are probably, at that age, your biggest avenues.
Okay, and then I don't know if there's time for it in this session, but I was interested in that whole like independent eval out of the IEP process. I was kind of just that like, was curious to me. So basically, is the thought there that the IEP team will do their own evals, and how do you go about requesting an outside stipend to be used on a like better eval?
So this is very difficult and not typical. Usually, a school system will conduct their own evaluations and use those results. You can dispute the results. You can say various things. You can say that the testing circumstances were not ideal. You can say that this is inconsistent with what the academics are showing in the classroom, a variety of things to dispute the results of the school's evaluation. In most cases, the school will come back and say, no, we did a good job. This is what you get. In that process, sometimes families will secure the services of an advocate who will come in and push harder. At some point, sometimes a lawyer will step in if you're really feeling like they're pushing back hard. And with those external supports, oftentimes you can make a case, but make a case for the school to then pay for more and bigger, you know, wider scope evaluation outside of the school system. It's a process. It does take a lot of fighting to get there, and I'm sure folks who've been through it could probably share a little bit about that. It isn't an easy thing, I can say, but it's there.
Okay.
It is there.
Yeah, that helps things. I was trying to, we went through an appeal process for Medicaid, so it's kind of probably similar. Thanks. question over here. Yes? Oh, okay. Okay. And then you had one more?
Just about the timing and the pattern of neuropsychs that you asked about. You know, for SSI and Social Security benefits, you really have to show a pattern over all the years. You know, but it's different now with the JDVS diagnosis because you all probably already have that coding. But I had to make sure that Bradley had the testing updated, you know, periodically, especially when we applied for, you know, disability status under the federal system. So, and then when he moved to New York for New York benefits, I had to update it in 2017. So you need to update it periodically for all of those reasons.
Great, thank you. I want to say thank you to Dr. Jenny Klein Sosa for being here. We are going to shift into this morning's